My name is Dr. Taiwo Sheyanwo. I'm a partner in Tower Hill Medical Practice. I'm also the clinical lead for Migrant Health. Sandwell and West Birmingham CCG commissioned some work following the results of the census in 2011, which showed that the demographic profile of the area, the region, i.e. Sandwell and West Birmingham, had altered considerably. And this showed that there was a high population of migrants in the area. Some of the individuals had a poor grasp of the English language and consequently of how the English health system worked. And therefore, these difficulties extrapolated into how they accessed the use of the NHS. We also realized that some of the problems that they presented with, due to the delay, caused considerable and a misuse of the services that were available, including accessing, say, A&E. We believe that understanding the routes into the NHS via GP services, i.e. primary health care, can ultimately result in a much better outcome for the individuals involved as well as the NHS. And ultimately, that was the aim with regards to this project. We realized as the CCG that this piece of work, important as it was, could not actually be done without the use and the help of the voluntary organisation sector, and therefore their role was pivotal in being able to establish our goals.
My name is Teresa Clements and I work for Brushstrokes, which is a community project, particularly working with the migrant communities from all over the world, and that includes asylum seekers, refugees and economic migrants. The Migrant Health training covered the broad spectrum of services which are available within the NHS and how that relates to accessing services by migrant communities and when it was appropriate to access which service. That training was then cascaded to migrant groups who themselves acknowledged their understanding of the issues, and within their own communities were very happy to pass on the knowledge they had gained to other members of the community.
My name is Megan. I'm a migrant myself. On the daily basis, I deal with huge problems which migrants have to deal with in regards to healthcare and access to the healthcare. The lack of explanation to people how to access all of the services is very needed.
My name is Fatima Diriye. I come from Somalia. My children, they born in Netherlands, and except for last baby, she born here. She give Teresa advice for NHS and for health. How when we want to go to the hospital and GP, it's very good for us because some people they don't know how to go to the GP, how to go to the hospital. She explained for our language, and yeah, that's good advice for us.